Let us introduce the speaker for the Dr. Arturo B. Rotor Memorial Lecture. He's a clinical associate professor at the University of the Philippines College of Medicine, chairman of the Subspecialty Board of Pediatric Cardiology. He's a former head of the Center for Congenital Heart Disease at St. Luke's Medical Center, BGC, and former chair of the Institute of Pediatrics and Child Health at the same institution. He's the former chief section of cardiology at the Philippine Children's Medical Center. He's the head of the Pediatric Cardiac Catheterization Program of the Philippine General Hospital, a former director of the Philippine Heart Association, a director of the Philippine Society of Cardiac Catheterization and Interventions, and currently coordinator for public affairs and spokesperson of UPPGH. To talk about MD Chronicles of COVID-19, let us welcome Dr. Jose Jonas del Rosario.
I would like to take this opportunity to thank the Philippine Society of Allergy, Asthma, and Immunology for this kind invitation, for making me this year's Dr. Rotor Memorial Lecturer. I also would like to congratulate the men and women who have worked so hard to make this 19th annual virtual convention a reality in spite of difficult times.
It has been 18 months since COVID-19 has been declared as a pandemic by the WHO. Caused by the novel coronavirus, COVID-19 is arguably the most catastrophic pandemic since the Spanish influenza in 1918. The world was caught flat-footed and unprepared. The deficiencies and inequalities in the healthcare system of many countries, especially those in the third world, were evident. It also exposed the vulnerabilities of the doctors who have been tasked by default to take the center role. Dealing with COVID-19 is fighting a war against a new invisible foe. And in this war, the doctors are expected to be at the front lines of this health crisis, acting as generals to rally the troops of other healthcare workers who put their lives at risk. In this pandemic, physicians have assumed different roles to contribute to the fight, depending on one's specialization, circumstances, choices, and beliefs. The more senior members of our profession are mostly those working from home, doing teleconsultation, while the younger ones are tasked to do bedside rounds. Aside from direct patient care, some of us are administrators in charge of the hospital operations, while others are researchers involved in the clinical trials or in the critical appraisal of scientific papers. Some are educators conducting webinars to increase awareness about the disease, while others are involved in risk communication. Some are asked to be consultants to guide in the making of policies and guidelines that are adopted by the government, medical societies, and even private organizations. Many of us are part of the general citizenry, helping other frontliners in terms of financial, logistical, or moral support. The decision to be involved in direct patient care is a difficult task. It is but human to get worried and be afraid. I am sure that many of us would rather be pre-pandemic regular physicians with more secured lives in exchange of being put on a pedestal as COVID-19 modern-day heroes. We are now aware that not all doctors treating COVID-19 patients are happy and contented with their job. Some of us, including our residents, fellows, and medical students, have been affected psychologically and have given up the fight. Managing sick COVID-19 patients in the hospital is a serious matter, which requires resilience and dedication to handle the physical, mental, and emotional stress that go with it. During the first few months of the pandemic in our country, the stories of Filipino doctors, some of them were our teachers, colleagues, and even close friends, brought a chilling effect to our fold. It drove home the point that healthcare workers can die from COVID-19. In addition, stories of overwhelmed hospitals, scarcity of PPE, the increasing rate of transmission, the absence of any proven treatment, and the thousands of people dying from COVID-19 worldwide magnify this fear. When I interviewed different healthcare workers on the front lines, the biggest fear that they have is the fear of getting infected and transmitting this to their family members. This fear has made people do illogical and unkind acts. It brought the worst in us. COVID-19 is like a modern day leprosy. Having the disease is a stigma. People get discriminated once their RT-PCR test becomes positive. There was a time when people were hoarding stuff like masks, alcohol, and even unproven medications. Many were overcharging medical supplies and equipment, taking advantage of panicking customers concerned with their own and their families' self-preservation. Quarantine and testing protocols became unreasonable and added to the suffering of our people. Healthcare workers in hospitals were frowned upon as spreaders of disease. Fake news circulated faster than the pandemic itself. Yet, in the face of disaster, I saw stories of kindness, courage, and generosity at the Philippine General Hospital. The resilience of the human spirit in the face of adversities were evident. The bayanihan na spirit became the driving force that propelled us to face the enemy head on. On March 20, 2020, private hospitals from Metro Manila asked for government intervention as COVID-19 surges and their capacities are getting overwhelmed. The Department of Health turned to the Philippine General Hospital and asked for assistance. The idea was to centralize all efforts and resources into 3 COVID-19 hospitals adequately equipped and invested upon by the government. On March 30, the Philippine General Hospital officially became a COVID-19 referral center. It was a hard and controversial decision at that time. Those who opposed were concerned that this move will be depriving the non-COVID patients of the hospital and probably will have a negative impact on the training of many of our students, residents, and fellows. In the end, upon the blessing of the UP administration, PGH answered to the call of the times as we felt that it was the right thing to do. Little did I know that that decision will be the start of my roller coaster ride with this virus. On my 55th birthday, March 29, 1920, I began to be deeply involved in the PGH COVID-19 operations as part of its crisis committee. As the spokesperson, I was in charge of discussing current events and advisories in the media. At the time, PGH was becoming the benchmark for hospitals on how to manage the crisis. I read scientific journals, attended webinars, and consulted experts to better understand the issues related to COVID-19. I helped accept donations, promote the convalescent plasma program, reach out to quarantine centers in Manila, and gather inspirational stories from survivors and healthcare workers. I listened to our frontliners and reported their concerns to the administration. Occasionally, I donned my level 4 PPE to perform life-saving cardiac interventions in the cath lab on COVID-19 kids with heart diseases. I viewed COVID-19 as a job assignment, my professional contribution to the cause. 3 months later, in a blink of an eye, COVID-19 became personal. My greatest fear was realized when both my parents were admitted to PGH almost at the same time because of severe pneumonia. I can still remember and see the worried looks on their faces when I told them that they needed to be hospitalized. My dad celebrated his 90th birthday, the oldest patient of PGH at that time, hooked to a high flow oxygen machine as my mom was being wheeled to the ICU for intubation because of impending respiratory failure. For nearly 2 weeks, I visited them in my level 4 PPE. I would spend about 4 hours in this COVID facility, checking on their progress, talking to their doctors and nurses. I cherish the moments when I was allowed to be with them, oblivious of the high risk exposure I posed upon myself. As my mom was mostly sedated in the ICU, I spent a longer time with my dad. I would bring him food, chat with him, and put him to bed at night. I wanted to make both of them feel that everything would be all right, that I was with them every step of the way. I knew the odds were stacked against them, but I was hopeful of a good outcome since they were in good hands. Unfortunately, a couple of weeks later, on my son Jared's birthday, I was told that my RT-PCR was positive and my viral load was high. I also had to be admitted for severe COVID pneumonia. I had fever, chills, headaches, and difficulty of breathing. I also had to be hooked to a high flow machine and received all the necessary treatment I knew at the back of my hand. I experienced how it was to be a COVID-19 patient with all of its physical and emotional challenges. I was told then to focus on getting well and not worry about my parents, who were relatively stable at the time. My hospitalization prevented me from visiting them, which I found most distressing as the opportunity to hold them tight was no longer possible. Nothing prepared me when both of them succumbed to the disease one after the other. They suffered a lot from COVID-19, and I was not with them at their bedside in their final moments. Closure was difficult because the normal ways of giving respect to a dying person is taken away. It is by far the most painful experience I have gone through. My COVID-19 experience taught me valuable lessons as I went through my journey as a doctor, a patient, and a loved one. I understood more deeply how it was to be a doctor or nurse at bedside in uncomfortable PPEs, to be a patient fighting for dear life, and to be a family member losing a loved one to this unrelenting virus. The experience definitely has made me a more compassionate and credible PGH spokesperson. In our last conversation, my dad told me more than material things, personal family relations are what mattered the most. I am glad I've been given a second chance in life to make up for lost time with my family. My pious mom, who died on the birthday of the Blessed Virgin Mary, wrote on a simple white paper a reminder to me before she slipped into coma. Magdasal ka. In my moments of despair and sorrow, it was the power of prayer that allowed me to let go and let God take control. I am a recipient of His amazing grace through the kindness of countless people who prayed and took care of me so that I may survive and continue my mission in life. It has been a year since this tragedy struck our family. The pain of losing my parents has remained. Sometimes, when I see old people getting vaccinated, I wonder what could have been, but I know everything happened for a reason, and life goes on. How did I pick up the pieces and bounce back? In spite of this grief, what helped me find strength to go back to PGH and re-engage myself to the cause? The simple answer is gratitude. I am thankful that I am still alive to give honor to my parents who would have wanted me to continue to help as much as I can. I am blessed that my health has been restored so I can pay it forward. I was able to donate my convalescent plasma after 3 months of recovery. I shared and continuously have been sharing my story so others may learn from it. I listed the things that can be improved on to make the life of a COVID patient in PGH and other hospitals more bearable. Last March of 2021, during the second surge, I was part of a team from our UP Med Class 1991 that created a home care algorithm that is easy to understand and can be used by health professionals and lay people. This was shared across the nation. With this in place, we then organized the PGH Telegabay program. This is free teleconsultation being attended by volunteer doctors, mostly from UP College of Medicine alumni and PGH alumni, through the platform Facebook Messenger. It has engaged our kababayans who needed to be guided on how to manage their COVID-19 at home and when to go to the hospitals. I was amazed by the spirit of volunteerism since about close to 200 doctors volunteered. It is still operational until now. I'm sure you have your own stories to tell. Stories of loss, challenges, and little victories. Stories of kindness and heroism. In our own little way, what can we do to help as physicians at the front lines? Allow me to tell you 5 recommendations. First, be messengers of truth based on science. Fight fake news and disinformation. Read and be critical of the information being put out there. Use your influence as someone who is trusted by your friends, relatives, and even your communities. Be responsible because they will believe what you say. Second, be more compassionate with your patients and the other people around you. Always put yourself in their shoes. Be thankful that you are in a position to help. Build your own version of community pantry. There are just so many people suffering from this pandemic. Thirdly, volunteer. Be involved in activities that will promote vaccination. Join a group that promotes free telemedicine. Be involved in your communities. Reach out to the poor. Fourthly, always protect yourself. Take care of your health. Engage in activities and hobbies that will revitalize you. The battle is not yet over, and the country needs you more than ever. Lastly, always be thankful. Choose to be happy in spite of all uncertainties. You have your family and your friends and the enjoyment of their company. Most of all, you have the gift of life. Seize it. Sa PGH may kasabihan po kami, iisang bangka tayo, kaya bayanihan na. In this time of pandemic, our patients need us. The mantra, to cure sometimes, to relieve often, and to comfort always, rings true more than ever. Let us all be PGH. That is, people giving hope to our suffering nation. Stay safe, everyone. Maraming salamat po.